Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will learn what a deep brain stimulation system is, what makes up a DBS, who qualifies to receive one, differences between a DBS, RNS, and VNS, surgical risks, and potential side effects. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. According to the American Association of Neurological Surgeons, deep brain stimulation is an elective surgical procedure in which electrodes are implanted into certain brain areas. The electrodes are implanted in specific areas of the brain to control and prevent abnormal brain activity. An implantable pulse generator is placed under the skin in the upper chest. According to Cleveland Clinic, the deep brain stimulation system consists of 4 parts: leads or thin insulated wires that end in electrodes that are implanted in the brain, a small pacemaker-like device called a pulse generator that creates electrical impulses, extension leads that carry electrical pulses from the device and are attached to the leads implanted in the brain, and a handheld programmer device that can adjust the device's signals and can turn the device off and on. According to Mayo Clinic, brain stimulation is used to treat conditions such as Parkinson's disease, potential tumors, dystonia, epilepsy, and obsessive-compulsive disorder. Doctors will see how high the risk is for any patient before recommending the procedure. Doctors will map the areas of the brain to see where the electrodes need to be placed. Depending on the area of the brain that is affected and the type of seizure activity that is taking place, physicians will decide what device is best for the patient to control seizure activity. Other options are vagus nerve stimulation and responsive neurostimulation. Just like medication, what works for one patient might not work for another. It is important, based on the patient's medical history, to take everything into account before deciding which route to take. Just like any other surgery, there is a risk in receiving a DBS. Risks include a 1% risk of brain hemorrhage, including stroke, infection, device malfunction, lack of benefit for certain symptoms, headache, worsening mental or emotional status. Additional surgery risks include misplacement of leads, breathing problems, nausea, heart problems, and seizures. After having a deep brain stimulation device implanted, patients experience different side effects. Side effects can be mild to serious. Side effects may include temporarily tingling in the face or limbs, a feeling of pulling in the muscles, speech or vision problems, and loss of balance. Additional side effects are seizures, infection, headache, confusion, difficulty concentrating, stroke, hardware complication such as an eroded lead wire, and temporary pain and swelling in the implantation site. Call your physician at once if you experience any of the following: severe and persistent headaches, bleeding from your incision, redness or increased swelling in the area of the incision, loss of vision, a sudden change in vision, or a persistent temperature of 101 degrees Fahrenheit or higher. It is important to follow up with your physician and follow your recovery plan to increase the chance of having a successful procedure. Communication with your physician is essential, so keep a journal of any side effects or symptoms you are experiencing. Adjustments may need to be made on how frequent your device goes off to control seizure activity. Your physician will make any necessary adjustments as needed. In conclusion, deep brain stimulation is an elective surgical procedure in which electrodes are implanted into certain brain areas. Conditions such as Parkinson's, dystonia, and epilepsy can be treated with deep brain stimulation. Deep brain stimulation is considered for patients who are drug resistant. Depending on the area of the brain that is affected and what type of seizures are taking place will determine what device a patient can benefit from. Like other surgeries, there are risks, and it is essential to listen to your physician when it comes to recovering and letting them know if any complications are taking place. To learn more about deep brain stimulation, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.